students actually start coming through and using this program?
Well, we already have the College of Pharmacy students
Okay.
rotating through.
Okay. But the doctor or the residency?
The residency,
doctors,
well,
yeah.
we still have to meet accreditation requirements before we can have our own residents. That's not to say we won't have residents rotating through from Oahu, from the program over there. In fact, residents from over there have already been rotating through for the past number of years with Drs. Dolan, Kurahara, Irvine, Shikuma, and Belcher. And,
Right.
and they are named in the program for you.
Okay.
So residents and students, our medical students, are rotating through Hilo as part
Just
of a
not
rural
as,
rotation.
not as a separate program yet.
Right, and
Okay.
so, and our task here is to build a community-based family medicine residency program to train family physicians to help meet the need, the physician shortage need in Hawaii, or in the state of Hawaii.
How far do you guys think you are from the accreditation process?
Well, we need some more faculty physicians. And then once we secure the faculty physicians, then we'll be able to apply for our accreditation. So we are at least, and I emphasize the word at least, 2 to 3 years away.
Okay.
It's a marathon, not a sprint, and I emphasize that all the time whenever I talk about this. And it has to be done well from the start, carefully planned instead of rushed. And so in order, as I said before, in
And
order
that the
to
funding comes in
exactly
too.
So in
Yeah.
order to secure competitive faculty and to be able to recruit competitively, which is what we need and want for our community, we do need funding.
As the sponsoring hospital of the Hawaii Island Family Health Center, we are indeed excited about what this interdisciplinary program means for our medical center, for our community, and for the state of Hawaii. And taking a phrase from the United Way, working together works, the hospital has been diligent in its approach to following the national standards of accreditation as we've established this clinic.
I've made a number of trips over to the Big Island to help this process move ahead as best as a school leader can do. And I'd like to say and paraphrase an expression that Pat Blanchette, the head of our practice plan, uses. You know, there's a lot of collaboration that's necessary to make things happen. And the John A. Burns School of Medicine is part of the University of Hawaii, not the University of Honolulu. So we're here throughout the state, for the state, and I want you to know that.
Patience, persistence, and long-term partnerships. Does that sound familiar to anybody in this area today? I'm going to echo the comments of the people who preceded me and say that what we're celebrating here today is an accomplishment that I think is maybe unknown in the history of Hawaii. I can tell you as a dean at UH, it's not that often that you see the leaders of 4 health sciences programs sitting in the front row together talking about activities that we've undertaken in a community setting with the leaders of the community there. I'd like to believe, and I think you will believe with me and us at UH, that this is the first of many similar efforts. We're honored to be embraced so well by the community in Hilo and to have an opportunity, I think, to make a difference for the patients who come into the center, but as important, to get you the workforce that you need to deliver the kinds of care that your community needs to improve the health of people on the Big Island.
Over the last 3 years, we have grown from, I would say, nothing to a faculty and staff of about 40, to a student body of about 270. We have very good accreditation status with all the accrediting bodies. And over the next 2 years, we will continue growing to maturity, which we expect will be a student body of about 350 and a staff of faculty and staff of about 70. And And our mission is clear, and that is to improve health and health care in Hawaii and throughout the Pacific. But at the same time, our goal is to become a top-rated college of pharmacy. Our goal is to become one of the top 25 colleges, which means that we will need to excel in what's called the tripartite mission of the university in teaching and scholarship and service. And obviously service is a very important component. But along the way, analyses have shown that we probably will also contribute about $50 million a year into the economy of the state of Hawaii. As Ken mentioned, last week our student pharmacists organized a health fair, and the health fair was very well attended. About 200 people from the community showed up, and the students showed their leadership capability. And it was another milestone in our history, and I was able to address that group briefly, and I told them that we are not a college that basically will hang out in an ivy-covered tower and be academic snobs. And there are many reasons for that, and one is ivy's on the restricted plant list, and the other is the Big Island is earthquake prone, so we don't build towers. But the main reason is that we're here to serve and to improve health care. So some of you know we've already established scores of affiliation agreements with clinical sites, so our students are already out in the field, in the sites, in the hospitals, and the community pharmacies. But you may not know that we also manage a clinical site in the Aging and Disability Research Resource Center here in Hilo. We also offer continuing education for physicians and for pharmacists. We're developing a pharmacy residency program, and this facility will help us with that greatly. We're forming a drug information center, and all of these things are first in our history, first in the history of the state, and certainly in actually in the entire Pacific region.
I grew up on Lanai, and then I went to UH Manoa and went to nursing school there, and then I came back to take care of my community. And I could really see there clearly how collaboration was so necessary in a rural setting. And now, being on the Big Island for 23 years and looking through the lens of a nurse educator, I really envision this setting, this facility here, as bringing together education and practice to provide really the best, as John says, the best quality of care to our community. And along with that, the added bonus is the collaboration that we will have and will see with pharmacists, with physicians, with nurses, with advanced practice nurses, someday with doctor of nursing practice, is research. That's what I find so exciting here today. I really see that as a vision, so I'm looking forward to that.
HMSA and the HMSA Foundation that I represent are proud of the community partnership that came together to create this reality, this new clinic. This is something we've all looked forward to, and we're very happy and proud of that partnership. After many years of financing the recruitment of physicians to our neighbor island communities, we saw this project as an opportunity to, as I say, grow our own.